area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare home care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. AMP2.TV presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to the Living a Longer and Healthier Life show for this Tuesday, August 21st, 2018. We're going to talk a lot about primary care this evening, but also more direct primary care of Boca Raton, which is a concierge medicine membership-based practice with Rachel Huerta. She's the ARNP there. So, nurse practitioner. We're going to talk about a little bit about concierge medicine, which is the model, telemedicine, which I'm really interested in. I mean, I know you've heard about it, but it's really here. Diabetes, of course, and some really neat options, kind of outside the realm, if you will, that you're thinking, health, you're thinking health insurance. Here's a model that maybe you don't really need health insurance. So, without further ado, Rachel, I want to welcome you back to the program for the third time.
Thank you. Thank you for having me.
Thank you for coming along. I always say on this adventure of health, because we always learn so much with, interviewing different providers. And you're right here in this area. If I can remember, I was at your grand opening. Was that about a little over a year ago?
That's right. Well, not a little over a year. It was in October, almost a year ago.
A little less than a year ago.
Yeah.
And you're over right by Boca Regional Hospital, right across the street, right?
Exactly. 801 Meadows Road, Suite 111. So a great prime location.
And I remember plenty of parking right there.
That's
right. It's a great
right.
location.
It's
That's always
great.
important.
Yep. And I'm in the line with a lot of other physicians that are in the office, many of which my patients are able to access for cardiology, gastroenterology. So it's a wonderful place.
And you have the hospital right there.
Exactly.
As well. And your organization, or your practice, I should say, Direct Primary Care Boca Raton, is a little bit different, as I was getting into. Am I correct when I say it's
Yes.
concierge medicine?
I like to say membership medicine.
Okay, that works.
It is very concierge service because we do offer access to your healthcare provider, which is myself, which most offices don't provide that same level of, like, here's my cell phone, call me when you need me, or same or next day services, or telemedicine. But it's membership medicine, which means that you pay monthly, and it's very much like a gym membership, and you don't have to front the whole 12 months up front. We also do a 30-day contract. So if something changes, we know we live in a transient area. So if you're moving, something changes, you can always give us a 30-day notice to cancel your membership.
Oh, wow. And I'm going to ask you a couple times about that during the program, because I think that's so important to have options in your healthcare. We talk about that all the time on this show. And we are live on Facebook on All County Healthcare INC's Facebook page. So if you ever want to see one of the shows, this show, if you want to go back to it and you missed something, you can always go there, or allcountyhealthcare.com has a radio tab there as well, where it's like an archive for the shows. We're on YouTube. We're everywhere. globally
Yeah.
on the iHeartRadio app. But let's go back to that for a second, because that's very interesting. You explain it like a gym membership in a way. Now, are there different, people always ask me about costs. Are there different costs for different age ranges, maybe?
There are. So it's tiered based on age. So I do take patients of all ages. So pediatric patients are $35 a month, and they have to have an adult membership with their membership. Adults start at $65 a month. It goes up to $85 after age 40, and it's $100 a month after age 60. And that's all the patient pays for their office visits and telemedicine for that month. They don't pay any additional copays, deductibles, office visit fees to be seen.
And hopefully they don't need it, but it's unlimited, and
Exactly.
it's 24/7.
It's really great because sometimes when you go to the office, you may have some questions you think of afterwards. They just pick up the phone and they text me through our HIPAA compliant telemedicine app, which is really neat service.
Nice.
All of our members get that as part of their membership, and it's their way of being able to connect with me. They can text, they can email if we need to do a telemedicine visit or a FaceTime visit through this app. It's all HIPAA compliant, so it protects their patient privacy.
That's great to know as well, that you're taking the time to, be in line with HIPAA as well. Now, I follow you on Facebook. You have some really great posts. You recently shared a video. You've been doing a lot of videos lately. I've been watching them. That's great.
Yep, trying to get out there.
Welcome back to the school video, and cool information about how parents can get their children's flu shot for free in the convenience of their school. I saw that on your Facebook page. So how did that come about, and why did you want to share that?
Yeah, so I met another vendor at a fair, and it's Healthy Schools. And so their community manager, her name is Paula, she actually came over to my office yesterday, and we did a Facebook Live where we were telling parents about the option that they have if they want to have their children vaccinated for the flu while they're at school. It's a convenient thing. It doesn't cost them anything to do this. All the kids in Palm Beach County, if it's in a public school, charter school, should be coming home soon, if not already, with a paper, and it's a yes form, meaning that if you don't sign off on it, your child is not going to get the vaccine. But they'll actually bring a team of nurses to the school site, do a one-day vaccination. So if your kid's not in school that day or sick that day, there's no makeups. But it's a really neat way to be able to vaccinate children and make sure everybody's protected.
When I saw this video today, I was actually looking up info about immunizations, and I have a little fact to share. According to the World Health Organization, between 2 to 3 million deaths are prevented each year due to immunizations. So it's important, to get the flu shot. There's a whole bunch of reasons, and I'd just like to release the stigma on the flu shot, because I've been getting it for years, and, knock on wood, I haven't been getting the flu. So
Yep.
I think it's an antibody that builds up in your body. So
Well, and the other thing is, it may not protect you against the strongest strain that's out there. It still does give you protection, and we saw that last year. This year, it's a quadrivalent vaccine. And, I always tell people that, okay, maybe you're not somebody that will normally succumb to the flu, but you could pass it along to somebody else who can't. They don't have that immune system. Small kids, adults with poor immune systems. So as a healthcare provider, I don't get it just for me. I get it for everybody else that I come into contact with. And there's that misconception of I'm going to get the flu from the flu vaccine. Doesn't happen unless you take the nasal vaccination, which not many people do. So it's actually a dead virus. And yes, do you feel crummy afterwards? Sometimes people do, but that's just your body's way of responding to learning the new viral code. So you're going to feel a little tired, a little achy, a little low-grade fever,
Yeah,
So.
I feel a little annoyed that day after I get the flu shot for a couple hours, but then I'm fine. But it's worth it, because, like as you said, elderly in our area, we got a huge elderly population, can be affected by the flu in a way that the normal healthy adult population wouldn't be, and children as well. Unfortunately, last year I read about a 12-year-old boy, I believe in Palm Beach County, who actually passed away from the flu, unfortunately. So, and I saw that in a couple of doctors' offices I was in. So, I think it's important for everyone to at least, be informed and find out where they can get the flu shots, whether it's at school. And I also was talking to you, and you offer flu shots right at Direct Primary Care of Boca Raton.
I do. So one of the benefits of being a member of the practice, And I do see patients as a one-time office visit fee, but the real value is in the membership. And so all of our members get a flu vaccine for free. We pay for it for them. So whether it's a child or an adult vaccine, we do offer it. So that's a nice little bonus there for all of our patients. And I'm all about wellness and educating. So to me, that's like one more thing that I can provide for my patients to help them stay well.
Definitely. And we're here with Rachel Huerta, ARNP. So ARNP, if you would define the acronym for us.
Advanced Registered Nurse Practitioner.
And I know I had nurse practitioner. I missed the other ones, though.
And I'm trained in family. I'm locally trained. I am from FAU. Go Owls.
Yeah, go Owls.
Yeah.
Wow. Me too.
And we talked about we've even gone back further from Jupiter, but my education at FAU was excellent. Master's degree is the family nurse practitioner track, and nationally board certified through the American Academy of Nurse Practitioners, and been practicing in the area for a long time. This practice is a new concept, new healthcare model, the first direct primary care practice in Palm Beach County. So that's super exciting to be the one, forging the new pathway out here for providers and for patients.
Definitely, and it's the website is dpcboca.com. It's a great URL there, easy to find. You don't have to type in anything. So again, dpcboca.com. There's a ton of info there, and take the time to Google Rachel's name, Rachel Huerta, Huerta, and find the Sun Sentinel article on direct primary care. It is excellent. Ron Hurtabice, I'm a big fan of his writing. I always read his health columns, and I shouldn't say health columns, health stories. He does a lot of health stories. Actually got a few story pitches published through Ron in the past, so I always look out for his stuff. He does really great work, and it kind of explains the whole model. It's a great article.
Yeah, I'm really thankful that we've gotten a lot of publicity from the newspapers locally because it is such a new concept. Everybody is so frustrated with the healthcare system for one reason or another. And so this healthcare model really takes all the red tape out of healthcare. It puts the patient and the provider back in the driver's seat for healthcare, no longer being dictated by insurance companies for authorizations or co-pays, even for labs and medications, all those things that we can do in our office and actually get better pricing for our patients and what the insurance rate would be. So for a primary care option, I think this is a really great way to go. Obviously, our membership covers our services, so it doesn't cover anything outside of our office, such as specialist visits or ER visits. So, that's kind of where the health sharing or the high deductible insurance comes into play for that.
Yeah, because it's going to be maybe 2-3 times lower in cost than what you would pay a deductible. I'm doing the math in my head for the numbers that you gave out, and I want you to give them out again before the end of the program. But some great points there as well. I was reading on one of your website pages about 80 to 90% of the reasons you go to a doctor can be covered at direct primary care at Boca Raton. I mean, 90% of the reason that you would go to a doctor.
Yes. So if you're thinking, I need my wellness visit, or I need a pre-op visit, or I'm sick, or I need a minor procedure done in the office. I've even had patients that had an abscess on a weekend, right? So majority of patients with insurance, they wouldn't have been able to get into their primary's office. Their offices would have been closed. They would have shown up at an ER to have an incision and drainage of this abscess. It would have cost them thousands of dollars easily. And my patient, who's a member, this is a member access, came into my office. I did the procedure for her. She left $45 later with an antibiotic in hand, culture sent out, and the procedure done. And
the relief of having that abscess, if you've ever had one.
Exactly.
Yeah, definitely. Let's take a quick break. On the other side, I'm going to tell you a little bit more, well, Rachel is as well, about direct primary care of Boca Raton.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7025 7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision and only your decision on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
And we're back with Rachel Huerta, ARNP. So I know that is now advanced registered nurse practitioner.
That's right.
I got it right this time. Direct primary care of Boca Raton. It's dpcboca.com. There's a ton of info. As Rachel said before, they're right over by Boca Regional Hospital as well. And I'm scrolling on your website, 801 Meadows Road, Suite 111, Boca Raton. Mm-hmm. And the phone number there as well?
That's right, 561-530-2622.
Perfect, thank you. And we'll give that out again. I'm looking on the website right now, and the first thing that popped up is low-cost labs and imaging. And that's important. I was reading a little bit today from actually comments of patients of yours on your Facebook page about how they were able to get prescriptions filled, some of their prescriptions filled. Well, this guy got all of his prescriptions filled right in your office, in the office.
In the office, yes.
Not call over to the pharmacy.
Exactly.
You got to go over there,
Exactly.
wait in line, drive through this and that, knock on the window, get their attention. This is right in the office?
Right in the office. Before you even leave your office, you leave with a pretty little DPC bag with your medications. This is one of the signatures of a direct primary care practice. It's not only accessibility and affordability, but it's also dispensing of medication. So I actually have a dispensing license, and any generic medications I usually can get at a fraction of the price of what you would get even when you're paying cash at some of the local pharmacies. So my patients have really enjoyed both the ease, like you said, if you're not feeling well, you don't want to have to make one more stop at the pharmacy. So
Or go back out.
Exactly.
Because you always got to wait a couple hours.
Exactly.
To get it filled.
So we're able to dispense right on site for those. Or if you're on a medication that you've been on for a long time, we've actually saved patients hundreds of dollars just by able to get their medications through our office.
That's fantastic. That's why I love this model. And also for labs, so like A1C, which I believe is kind of check for blood sugar?
It is. So it's a diabetes test that we check the hemoglobin A1C. I like to describe it as a panoramic picture of what your blood sugars look like over the last 3 months. And so that test is only $4.99 in our office. A lot of our tests are about $5, and many of those same tests would cost, I don't know, $50, $60, sometimes even more per individual test. And we can do a whole panel, like a wellness check. That's a 7-panel test for $42. So it's a huge cost savings. Plus, I draw the labs in my office. I get you the results back very quickly. So, and then I'm able to, with our telemedicine, send those labs right on over to you. So it's all about the patient having access to care.
And that's important. I saw another comment today. They said that they got their labs much faster than they normally would. And I think that's important because, when you have your blood drawn, you're always thinking, you want to get that info. You want to know what was seen or by your primary care physician and know what's going on. And sometimes you have to wait a long while. And sometimes you have to do a little, searching for that info. Or maybe a follow-up appointment. And there you're saying like telemedicine. So let's talk a little bit about telemedicine. Is that something, you mentioned it before, is that something that someone with an iPhone can kind of just connect with you on?
Yeah, so it's a really exciting app that works on a lot of different smartphones. Patients actually, when they sign up, when they go to our website and they click Enroll Now and they enter the information, they're signed up as a DPC Boca member. And then as soon as they do that, they get a quick response back from me. Thanks for joining our practice. Here's your link to your Spruce app. And they actually download the app. And then when they get a message from me, they may be somewhere and their phone's laying around on the table. They don't want their health information all out there. So it actually pops up that you have a spruce message. It doesn't put any of their patient private information on that message, but allows them to look at it later. So that's a really neat way for patients to be able to communicate with me and with them. And that also means that, if I'm doing a home visit, because I sometimes go and see patients in their homes as well, I am not limited to being stuck in my office to answer my phones. Those messages actually come wherever I go. So that's a really nice convenient thing for them too.
Home visits, that's a blast from the past. But a lot of people will tell you that they wish that there was more of that going on in the healthcare sector. Well,
and it's sometimes easier for patients in certain patient populations for me to be able to come to them. Sometimes it's an urgent need. I actually had a patient that thought she had the flu. Turned out she had a very severe kidney infection. And, because I was able to do a home visit, that allowed me to be able to really get access to her quicker and get her medical care the way she needed. So
that's a big deal because time is in the essence of those kind of situations as well. You mentioned members, and I know you started less than a year ago in Boca Raton. And how many members do you have today in direct primary care of Boca Raton?
Sure. So we have a little over 140 members of our practice, which is a really nice growth rate for being open for about 10 months. We have a cap, and so this is how we're able to provide the level of care, the level of service. We don't take on the same amount of patients that a typical primary care practice would take on with an insurance model. So we have a soft cap of about 500 members per provider. And I say soft because, you may have friends that come in town or family members that want to join the plan, and we always want to make sure there's room for those people in our plan. And then we do have plans for expansion with another provider, maybe even additional location if it's needed. We've had patients ask for that. We're like, when are you coming to this city or when are you coming to that city? That said, with our telemedicine app, we actually have patients that span all the way down through Pembroke Pines, all the way up through the Treasure Coast.
Nice.
Yes. So that's a really neat thing because they come in for their first office appointment, and if they only need to come in a couple times a year, it's worth the drive. They don't sit in my waiting room waiting to be put back for 45 minutes or being staged through the medical office with only a 7-minute time that they have in front of their provider. So when they come in, if you could just imagine it, like close your eyes and imagine you come into my office. It's very Zen-like.
It is. It's a very easy office to digest.
Yes, it is. It's very comfortable.
It's got a very nice flow to it. I remember the opening day just noticing that. And there were like 500 people there.
Yeah, we had a huge turnout. It was awesome.
There was a guy making paella from the Delray Green Market.
We know how to throw a party.
Our friend there and his wife. Yeah, it was. But I remember the flow of the office. I mean, all kidding aside and not kidding, it was great.
Yeah.
It just flowed it was just very inviting.
Yes. And the cool thing is that all of my patients get their own appointment slots. So it's not like a waiting room where you're kind of waiting to be the next one in line to be seen. So when you have your appointment with me, I know you're coming. I'm expecting you. I'm waiting on you. And you are brought back immediately. So in fact, I have some patients that say, can I just sit out here for just a minute? I just want to enjoy this room because it's very peaceful and quiet. But I'm able to get my patients right back. So sometimes even though they're driving further to come to me, they're actually saving time as well because they're not sitting in a waiting room.
That's great to know. And again, it's Rachel Huerta, ARNP Direct Primary Care of Boca Raton. It's dpcboca.com. Like I said, right over there by Boca Regional Hospital in East Boca. 801 Meadows Road, Suite 111, Boca Raton. And if you'll just give out the number again.
Yes, 561-530-2622.
So I didn't ask you where you'll expand to next, but I kind of have some ideas in my head. I'm just going to throw them out there. I imagine this would be huge in East Delray Beach and maybe Boynton Beach because Boynton Beach is going through a renaissance. I live in Boynton. So just throwing that out there. But I do want to ask you about, since we have about 2 minutes, about small businesses. Can they get direct primary plans?
Yes, they can. This is really exciting because small businesses struggle to provide benefits for their employees. And we know that's important for retaining employees is to have some nice extra incentives for them. So there are small businesses that actually get a a group rate with our practice, and if they're interested in getting information on that, I'd be happy to supply it with it. But, we give the businesses a little bit of a break. We work with them, and then they can add in and subtract employees as they come and go. But it helps, especially with getting their employees in right away so that they're not missing as many work days. I can come to the work site if they all wanted to get the flu vaccine, because I can travel. I can be able to do those things.
That's important.
Yeah, so it's a nice incentive for the employers to be able to give something to their employees. It actually helps their entire business and helps the employees feel very valued, and it's very affordable.
Well, definitely, if you have a small business, I'll tell you, Rachel and her husband, Jody, they're very easy to work with. They get right back to you and help her double her business before the end of the year, double her membership size, because you're going to get a great primary care experience. Hard to believe again, another 30 minutes we're through, but thank you so much for sharing so much in the program. Take the time to search direct primary care, find the article with Rachel in it, Sun Sentinel. There's a great Chicago Tribune article. There's some info. A bill was signed by the governor this year.
That's right. A lot has happened in DPC.
Yeah, and this is a new model. And you don't take insurance. you walk right in. Yeah, that's huge.
No insurance. It's very simple.
And if you're into saving money with healthcare, you can probably save money with direct primary care. Boca Raton, I actually guarantee it because I'm running the numbers in my head. But thank you again.
Thank you. It's a pleasure.
See you next time.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.